Hi, hello everybody. I'm Dr. Zoe McMillen here at Lifescape Premier. Today we're going to give you a quick update about COVID-19, as well as maybe discuss a little bit about the potential for the J&J vaccine to be approved today. And then I'm going to also be talking about pre-diabetes and diabetes, focusing on risk factors, things that you can look for that you may be at risk for developing one of these, and also a little bit about how it can increase your risk of COVID-19 severe infection. So in Arizona, we're actually doing pretty well right now with COVID in that our numbers have dropped quite a lot compared to how they were with the surge over the holidays. So our 7-day average is decreasing. It is still higher than some of our neighboring states though, so we still have a little way to go. And with vaccinations, we're doing quite well compared to some neighboring states. So we actually have been vaccinating quite a few people, more than some of the neighboring states. With regarding J&J, Johnson & Johnson has submitted all their studies and tons of paperwork for the FDA to review, and they are expected to be coming out with a decision today. We are likely it is going to be approved, and this is really wonderful news. It adds a third vaccine to our arsenal. This vaccine is going to be a one-shot dose, so that's very convenient for many people, and also storage conditions are not as strict, and it doesn't have to be in as cold an environment as the Moderna and Pfizer-BioNTech vaccines. It is also very good at preventing serious illness or death, and that's really what we want out of a vaccine. Of course, we still need to keep, until we get enough people vaccinated, getting those case numbers down are going to help prevent more variants. If we just decrease the amount of virus around, then it can't mutate as often or as much. So, keep masking, social distancing. There is light at the end of the tunnel, and hopefully, we can see a time when we can return to a more normal life, which is going to be wonderful. You may have already heard our first part of our COVID-19 vaccination town hall event. We are going to host a second one. So this second week of March, make a note, stay tuned, and look out for the email about that event. We'll be discussing more about vaccines and answering other questions that we didn't have time for last time. All right, and then jumping into today's talk, you've probably heard in the media and, from your doctor maybe, that there are certain health conditions and risk factors which increase your chance of having a severe or serious illness with COVID-19. And one of the big ones is type 2 diabetes. And this is something that kind of a lot of people have, and when we actually look at numbers, 1 in 10 people have type 2 diabetes in the United States. And then when we look even more at, what's leading up to the type 2 diabetes, it's the pre-diabetes, and that's 1 in 3 people. So this is a pretty large proportion of society. So I'm going to be going into the different types. You may have heard of children who get diabetes. That's type 1 diabetes, where there is an autoimmunity issue. The body attacks the pancreatic cells, and the cells, die, and they can't make insulin. So they become insulin dependent diabetics. So that often is the one that happens in childhood. We are now seeing more cases of type 2 diabetes in kids as well. But type 2 diabetes traditionally has been when you're older, and that can be associated more with insulin resistance and obesity, which are big risk factors for type 2 diabetes. Type 2, you're making some insulin, at least early in the disease, just maybe not enough for what your body is needing. Later on in the disease process, you may need to get insulin and hence become insulin dependent. There are also gestational diabetes. That's where you have diabetes during pregnancy. It can often, resolve after pregnancy, but you're still at higher risk for developing type 2 diabetes, so you need to be monitored. And then there are some other lesser known ones that we won't get into today. Diabetes is, seems like you often don't feel symptoms, is what I'm trying to say here. You don't feel symptoms. You don't feel too sick early on when your sugar's a little high. You don't maybe feel it. And that's one of the dangerous things, kind of like with high blood pressure. You don't always feel it, but it's doing damage. So that's one of the things where we need to sometimes do labs to see is someone trending towards that direction and hopefully reverse it before they get there. You may want to know more about insulin resistance. I mentioned that with diabetes. And with insulin resistance, what is that? So it's basically, a definition is a subnormal glucose response to a certain level of insulin. So basically, your body, when you have insulin resistance, you can have high amounts of insulin for a small amount of glucose. It's just not working as well. You're resistant to it. This can be associated with obesity, stress, some medications such as steroids, and even insulin antibodies, where you've got antibodies against insulin. Some clinical features could be coronary artery disease, metabolic syndrome, polycystic ovarian syndrome, and non-alcoholic fatty liver disease. Some common physical manifestations can be central obesity, so you look more the apple shape, you're carrying your weight more around your middle. And you also, if you looked in the tissue, you'd have more fat deposition in the muscles and the liver. You can also sometimes, with some people, see at maybe the back of their neck or in their underarms what we call acanthosis nigrans, where it's a darkening, thickening, almost velvety feel of the skin, so like darker, thicker area of skin. With pre-diabetes, that's more defined as a range between normal and diabetes. So you may say, well, what is normal? We would probably here at Lifescape say a normal blood sugar when you're fasting, when you wake up from overnight and you haven't eaten since dinner. A normal one is less than 90 for us. Traditional medicine will say less than 100. So pre-diabetes in the traditional sense is defined as 100 to 125 of a fasting blood sugar. Or if you do the hemoglobin A1C blood test, which we often here do at Lifescape when you get your premier physical, that one, the normal is less than 5.6. Pre-diabetes would be 5.7 to 6.4, and diabetes would be above 6.4. You may wonder, well, why is diabetes increasing? What's driving it? Why are now 1 in 10 Americans diabetic and 1 in 3 pre-diabetic? It's probably multifactorial, but a lot of it is our diet and our lifestyle. The standard American diet, SAD, is the acronym we use. It really is sad because we're not getting the nutrients we need. We're getting too much of things that aren't good for us. Processed foods, high carb, high fructose corn syrup, all of that stuff is just not good for us. 60% of all packaged foods in the US contain sugar. So if you're going and shopping in the aisles, 60% of the products you're looking at will have sugar hidden in it. And you may not even really be aware of it. But next time, look at the tomato sauce or your pasta sauce. Look at your mustard. You will see sugar hidden in everything. And of course, I'm not just blaming sugar. All of it plays a role. The highly processed part, food additives, preservatives, how the food is made, toxins that, pesticides, all of it can play a role in disturbing the gut microbiome as one side of it, and also just being the foods that your body it's not used to, it can't function optimally on. Unfortunately, higher than normal blood sugars or the insulin don't produce symptoms, so that's why we come in for your physical. Let's get labs. Let's make sure that we're catching this early on if you're tending towards it. If you are worried you have diabetes, some common symptoms can be blurred vision, thirst, increased urination, even weight loss at one point towards when you become a diabetic. You can lose weight. Some factors that increase your risk of type 2 diabetes are being overweight or obese, storing the fat in the central area rather than the hips or thighs area, inactivity, family history. So family history, as we say, the genes load the gun, but the environment pulls the trigger. Race and ethnicity, some groups such as Asians, Native Americans, higher risk of developing type 2 diabetes. Blood lipid levels being elevated is a risk factor. Age, of course, as we get older. And a history of high blood sugars, even in pregnancy. So what do we like to do? We also like to test fasting insulin levels here. That's really a first sign of a metabolic disturbance, far before you get the high blood sugars. So your blood sugar can be normal, but you're already starting up that path of insulin resistance. It's not frequently tested, and we maybe should make it more of a routine test to really look at your metabolic health. I know a lot of this sounds not so good, the news, but there is good news. A lot of this is reversible. Many of us here have helped bring people's hemoglobin A1C down to levels that are now non-diabetic levels. So we've reversed it. Some would argue you're still a diabetic, but you're, very well controlled diabetic at that point. It's really important to look at the factors from lifestyle changes, be it nutrition, maybe more movement. Of course, we sometimes need medications or supplements that may help. So if you do have a fasting blood sugar more than 90, or you have risk factors for developing diabetes, please talk with your physician about how to lower your risks. With regard to COVID, if you're lowering those risks, you're lowering your risk of having a severe or serious illness with it. I do want to remind everybody, please watch your emails for look out for an email from us regarding the second part of our COVID-19 Zoom town hall. We're scheduling it for the second week of March. Thank you, everybody. Please stay safe, and we'll see today. Hopefully the J&J vaccine will get approved, and we'll obviously get much more supply of it, and hopefully it'll get easier to get a vaccine. Thank you. Bye-bye.